Hello, my name is Hannah Lee. I am 26 years old and originally from Colorado. I graduated from UCD with a BS in biology, and the picture on the upper left is my family. My parents are originally from South Korea. I am currently in the U.S. Army working as a medic and am deployed with my unit in Iraq working in a Role 1 facility. The picture on the bottom right is my military family. In the near future, I hope to get into emergency medicine, and the Bible verse you see here is what my pastor read to me before I left for the Army. This Bible verse is what gave me the courage and solidified my path into the military. Today, my presentation will be about the accessory nerve. During the course of this presentation, I will be doing an overview of the anatomy, physiology, pathologies associated with the accessory nerve, and I will finalize this presentation with 2 Bible verses I have found related to the accessory nerve. The accessory nerve is the 11th cranial nerve. It is unique in the sense that it is the only nerve that does not originate from the brain. It is actually formed from motor neurons from the cervical spinal cord, specifically the C1 to C5 or C6. Our textbook only mentions that it is located somewhere on the first segments of the cervical spine. The motor neurons that form this nerve go up into the foramen magnum and eventually come together as the accessory nerve, exiting laterally into the jugular foramen along with the vagus and glossopharyngeal nerve. The accessory nerve mainly innervates the sternocleidomastoid and the trapezius muscle. The diagrams on this slide illustrate the locations of the accessory nerve. As the most caudal nerve, it can be seen underneath the vagus nerve, the 10th cranial nerve, which eventually it joins to innervate the different parts of the body. As it exits the jugular foramen, the nerve usually follows the internal jugular vein laterally downward and goes into the sternocleidomastoid. According to a paper published in the Journal of Laryngeology and Otology, it is more common for the nerve to pass the internal jugular vein laterally in what is known as the anterior triangle, after which it crosses the transverse process of the atlas. It continues to descend and passes the styloid, the stylohyoid, and the digastric muscles before it innervates the sternocleidomastoid muscles. For further information, see the accessory nerve anatomy and surgical identifications by Lloyd S. As it comes out of the sternocleidomastoid muscles, it enters the posterior triangle to insert into the trapezius at the apex. The accessory nerve is usually identified by surgeons as being just above the Erb's point, which is used to identify the upper trunk of the brachial plexus. The accessory nerve reaches the anterior portion of the trapezius muscle going across the posterior triangle posteriorly and inferiorly. It is said in the article before mentioned that it is relatively superficial, and due to the nature of this, it can be damaged quite easily during surgery or trauma. In the previous slide, I mentioned about the anterior and posterior. So the physiology of the accessory nerve. The accessory nerve has general somatic efferent functions, which means that it innervates the skeletal muscles, the sternocleidomastoid muscle, and the trapezius muscles, and this allows them to move due to the cervical spinal cord that makes up the accessory nerve, as mentioned before. The innervation of the 11th nerve allows the sternocleidomastoid on the right and the left to rotate the head so you can potentially see the opposite side. When they function together, they will flex the head to bring it forward. And the trapezius allows the scapula to rotate during the abduction of the humerus, elevates, adducts, and depresses the scapula. When there is an interruption of the accessory nerve for some reason, it has been shown that it can cause drooping of the shoulder, inability to raise the arm above the head because of impaired rotation of the scapula, or weakness in attempting to raise the shoulder. Interruptions are mostly caused by local surgeries, according to Dr. Preston and Dr. Shapiro. He stated that about 3 to 10% of injuries occur is in the posterior triangle of the neck during cervical lymph node biopsies, causing weakness in the trapezius. In distal spinal accessory palsies, a shoulder droop can occur due to an atrophy or weakness of the trapezius. The shoulder droop is caused by the weight of the limb and causes the scapula to move away from the spine laterally, creating a distance between the glenoid cavity, unallowing the shoulder to abduct. This can also cause mild scapular winging. The weakness of the trapezius muscle is also known as the shoulder syndrome and is usually associated with pain due to the strain of the joint that the joint places on the rest of the shoulder muscles, such as the levator scapulae and the rhomboids. So if damaging the accessory nerve near the posterior triangle can cause damage to the functions of the trapezius, developing a peripheral lesion in the spinal root can be detrimental to the function of both the trapezius muscle and the sternocleidomastoid muscle. The damage to the trapezius muscle is the same as if it were to be damaged by surgery. The effect to the sternocleidomastoid would be evident as the shape of the neck would lose its normal rigid shape and would lose rotary movements of the neck to the healthy side. Trauma to the neck is also likely to damage the accessory nerve as it is a pretty superficial nerve. Penetrating trauma such as a gunshot wound and blunt trauma such as whiplash or unsuccessful hanging of the noose are some examples. All of these injuries to the accessory nerve are thought to segmentally demyelinate the nerve due to local ischemia, which causes the weakness or the complete loss of function of the muscle. These are the two Bible verses I have found related to the neck and the shoulder. The first Bible verse is from Matthew 5:39, chapter 5, verse 39, King James Version. And it says, "But I say unto you, that ye resist not evil, but whoever shall smite thee on thy right cheek, turn to him the other also." It's one of the famous quotes to say, turn the other cheek when someone wrongs you, and to be the bigger person. And in order to be able to turn the other cheek to your enemies or to other people who wrong you, you need to have a working accessory nerve. The second Bible verse is from John chapter 19, verses 16 to 18, where Jesus was carrying his own cross on his shoulder to his crucifixion. And it says, "Then delivered he him, therefore, unto him to be crucified. And they took Jesus and led him away. And he, bearing his cross, went forth into a place called the place of a skull, which is called in the Hebrew Golgotha, where they crucified him and two others with him, one on either side, and Jesus in midst." So in this Bible verse, Jesus is carrying his own cross on his way to his crucifixion, and it's possible that the weight of his own cross on his shoulder could have injured his accessory nerve to the point where he could no longer hold his cross due to his trapezius becoming weakened by the pressure. And when he could no longer hold his own cross, that's when they brought Simon of Cyrene to help carry it for him on his way to be crucified. And these are my references, and that concludes my presentation. Thank you. Triangles of the neck, and I wanted to point out the borders for the anterior and posterior triangles. The borders of the anterior triangle of the neck is outlined by the anterior border of the sternocleidomastoid muscle laterally, the inferior border of the mandible superiorly, and the midline of the neck medially. And the posterior border is bordered anteriorly by the posterior edge of the sternocleidomastoid muscle, posteriorly by the anterior edge of the trapezius muscle, basally by the middle one-third of the clavicle, and apically by the occipital bone just posterior to the mastoid process, where the attachments of the trapezius and sternocleidomastoid come together.